takes dedication by the doctors and the staff.
It takes intelligence.
I think it takes compassion.
Phenomenal caring.
Progressive ideas.
People that care.
Leadership at all levels.
Just what it sounds, whatever it takes, whatever I have to do to make the patient, visitors happy, I will do that.
It takes people coming together and moving forward to a common goal.
Whatever it takes to provide the very best patient care that we possibly can. It's a culture that's existed here since the very beginning.
That compassionate care, that thing we used to call and still call the El Camino way, that culture not only is there, but it grows and gets stronger every year.
I think what's unique about El Camino Hospital is it's not just a community hospital in name. What we do here is what the community needs.
And I've lived in this community for a long time. It tends to be a community that wants to be involved, wants to look out for the other people in the community, and that's where El Camino as a community-owned hospital really fits in.
We don't have shareholders like a for-profit hospital does, we have stakeholders. Some people have said, gee, how can you be so successful as a standalone hospital? And in fact, we're not a standalone hospital, we're a stand-with hospital. We stand with our patients, we stand with our physicians, we stand with our employees, we stand with our community, and that's who we're accountable to.
Being an independent district-owned hospital, we control our own destiny. And when it comes to medical technology, we are able to make innovations happen very quickly here.
We are viewed as an industry leader in terms of adopting healthcare IT in order to improve patient care. Part of it has to do with the fact that we're in Silicon Valley, and part of it has to do with our history. We were the first hospital on the planet to go live with something called computerized physician order entry. And that actually is the single most effective way to reduce medication errors in a hospital.
I think as we have seen computers and technology in other industries, people come into the hospital with that same expectation.
We are going to speed the integration of this technology, and we're going to provide our patients and our physicians with access to this technology and begin helping patients and improving patient outcomes right now.
There's never been a more exciting time than right now. We have a beautiful new facility under construction.
We've had the opportunity to build the hospital that we wanted to have. Our new hospital will be the hospital of today and the hospital for the next 20 years for this community.
I am incredibly optimistic about the future. I think that this year is going to be a banner year for El Camino Hospital, moving into the new facility, driving all of our quality and service initiatives to the highest possible level, and merging with a sister hospital to the south. I think of us as an incredibly transparent organization. Quality and service is our #1 focus. So we have to do whatever it takes to get to be the very best of the best in all of these diverse areas. If you look at all of those traditional things that most hospitals focus on, you would say that El Camino Hospital is among the best of the best hospitals nationally.
When I first came into the hospital, I was like, wow, this has a different feel to it.
I knew right from the get-go when I came here that there were standards as a nurse that I had to live up to because all the people that are here expected more of me.
If it means that I stay over 2 hours to see that my patient gets what they need because we're having a code and there's a need for me to be there, then that's whatever it takes.
Average is never really good enough as far as I'm concerned. I always go above and beyond. I think basically the staff does the same, feels the same way and does the same thing.
It's one of the wonderful things about working at the hospital, going there, because it's a huge comfort zone. The nurses and the ancillary staff, the radiology department, the techs, it's a great group of people who are just working together for one single purpose, really.
We are striving to be one of the top hospitals in the nation. Because the community is the most important thing, we will never be average.
The most important thing that it takes to make a great hospital function is teamwork.
I think we all have a sense of pride, everybody that's there, whether it's somebody serving you food or operating on your leg or, doing major surgery. And I think they just come together with a kind of common bond, which is very welcoming and very, very warm, and makes me feel that they really enjoy what they're doing, and it's for a good purpose.
Without the collaboration of every different individual in the organization, that patient won't get better, no matter how fabulous their nurse is, or how fabulous their doctor is, or how fabulous their respiratory therapist is. They all have to be working together and being consistent and being on the same page and communicate in order to make that happen.
I think we're bringing hope every day to our patients. It's very important to have patients have hope for their future and good health.
I'll say it as I saw it back in 1994 when I first walked into El Camino Hospital, and I'll say it now in 2009. This is a good hospital. It serves with a personal touch.
It's because of you that we are who we are. It's not the bricks and mortar, it's not the wires, it's not the technology, it's not the equipment. It's you and your commitment to each other and to this community and to this hospital that makes us what we are.
This is my hospital. This is where I work. This is my place that I'm very proud of.
As an independent hospital,
Dedicated to the community.
We have the
Power to do whatever
It takes.
Whatever it takes.
Whatever it takes.
Whatever it takes.
To provide the best care
Anywhere.
Good hospital, good hospital.